Before undergoing a blood test, women should exercise particular caution. There are 10 common mistakes that can significantly skew the results, potentially delaying an accurate diagnosis or even leading healthcare professionals astray. Such situations are observed regularly. Even well-informed patients make easily avoidable missteps, leading to alarming conclusions that don't reflect their true health. This article will detail the most common oversights made by women, especially those aged 60 and over, before blood draw. Notably, one of these errors, specifically error number 9, remains little known even among some nurses. If your blood test results have ever puzzled you, it's advisable to carefully review the information presented here. 1. Forgotten or excessive fasting. This oversight is undoubtedly one of the most common, especially among older women whose schedules are often overloaded with numerous doctor visits, various medications, and daily responsibilities. The importance of adhering to fasting guidelines for certain blood tests, such as glucose, triglycerides, or cholesterol, cannot be overstated. Typically, this means a complete avoidance of food and all beverages except plain water for 8 to 12 hours before the blood draw. While seemingly simple, this is where problems arise. Some patients completely forget this instruction, having a light breakfast or coffee with milk, which instantly skews the readings. This can lead to abnormally high blood sugar or triglyceride levels, potentially resulting in a misdiagnosis or unnecessary medication. On the other hand, there's the opposite extreme. Some women fast too long, for 14 or even 16 hours, mistakenly believing that longer is better. However, such prolonged abstinence can cause significant stress on the body, trigger elevated cortisol levels, a critical drop in blood pressure, and even fainting during the blood draw. It can also temporarily impair normal kidney function or electrolyte balance. What's the solution? It is crucial to know exactly which tests you are undergoing. Always confirm with your primary care physician if fasting is required. If so, strictly adhere to the optimal 8 to 12-hour period. Remember, even black coffee and tea technically do not qualify as fasting, especially for lipid profiles or glucose tests, and certainly not with milk or sweeteners. Only plain water is permissible. 2. Medications that can affect results. This error is particularly insidious, and often the patient is not solely to blame. Healthcare professionals frequently forget to warn about potential interactions, and patients, in turn, don't always ask the right questions. It's crucial to understand that even common medications and dietary supplements can significantly distort blood test readings. For instance, biotin, widely used in hair, skin, and nail supplements, seems harmless but can seriously interfere with thyroid hormone tests, creating a false impression of hypothyroidism or incorrect medication dosage, while the patient's true health is normal. Anti-inflammatory drugs, like ibuprofen, can affect kidney function. Steroids can raise blood sugar and white blood cell counts. Diuretics can disrupt electrolyte balance. Even a seemingly simple supplement like vitamin D, if taken just before a test, can lead to falsely elevated calcium levels. The complexity lies in many women not perceiving vitamins as full-fledged medications. However, the body makes no distinction. Anything ingested impacts internal biochemistry. What should you do? It is crucial to thoroughly inform your primary care physician and the blood draw technician about all substances you are taking. This list should include prescription and over-the-counter medications, herbal remedies, vitamins, other supplements, powders, teas, oils, and even essential oils if ingested. In some cases, temporary discontinuation of certain supplements 24 to 72 hours before the test may be required. Always clarify this information in advance, and do not rely on guesswork. 3. Insufficient fluid intake. Imagine a typical scenario. A patient arrives for a blood test early in the morning, having fasted for 10 hours without food or drink. The nurse applies a tourniquet, but it proves difficult to locate a suitable vein. This happens because dehydration causes blood vessels to constrict, making them less visible and elastic. As a result, the blood draw can be more painful, require multiple attempts, and even lead to hematomas. Sufficient water ensures optimal blood volume, making the process easier for staff and less stressful for the patient. Older women are particularly susceptible to mild dehydration, as thirst signals diminish with age and skin and veins lose elasticity, even without overt thirst. This creates significant challenges for phlebotomists and, more critically, can negatively impact the reliability of results. In a dehydrated state, blood becomes more concentrated, which can lead to falsely elevated hemoglobin, hematocrit, and electrolyte levels. Even kidney function tests like creatinine and BUN can appear worse than they actually are, solely due to insufficient body fluid. The solution is simple. Unless your doctor has specifically instructed you to abstain from fluids, which is rare, it's recommended to drink 1 to 2 glasses of water about an hour before the test. Don't overdo it to avoid bladder discomfort, but ensure enough fluid for rehydration and vein plumpness. And yes, this must be plain water only, no juices, coffee, or other beverages. 4. Intense physical activity the day before. Physical activity is undoubtedly an integral part of a healthy lifestyle, and healthcare professionals strongly recommend daily movement for all older patients. However, it is highly inadvisable to engage in a full-fledged strength training session the day before a blood test. The reason is that intense physical exertion, especially strength training, causes micro-tears in muscle fibers. While natural and necessary for muscle growth, this process also leads to an increase in certain blood markers. This particularly applies to creatine kinase, CK, liver enzymes like ALT, and even lactate dehydrogenase, LDH. If you're being tested for liver function, heart problems, or muscle diseases, elevated values of these markers can cause false alarms that do not reflect a true pathological condition, but are merely a consequence of the body's recovery from yesterday's workout. For patients already prone to pain syndromes or misdiagnosis of inflammatory processes, such false positives can lead to undue worry or unnecessary medication. What is considered safe? Light walking, moderate stretching, yoga, and other low-intensity activities. However, you should avoid heavy lifting, long hikes, or any strenuous physical activity for at least 24 to 48 hours before the test, especially if the goal is to check liver function, muscle indicators, or inflammation markers. 5. Arriving anxious or agitated. Let's address an aspect often overlooked in test preparation instructions, yet one that absolutely impacts results: the patient's emotional state. When someone arrives at the clinic rushed, stressed, or out of breath, their body enters fight or flight mode. This triggers the release of adrenaline and cortisol, which can temporarily raise blood sugar, slightly increase blood pressure, alter white blood cell count, and even affect thyroid hormone levels or heart rate. For illustration, consider a patient who, running late, rushed in, agitated by traffic, and anxious about the upcoming needle stick. Her test results showed elevated cortisol and blood sugar. A week later, when the same test was repeated in a calm setting, all readings returned to normal. If you're investing time and effort in a medical examination, it is crucial to approach this process responsibly. It's recommended to arrive early, sit calmly for 10 to 15 minutes before the blood draw, and breathe deeply. Avoid scrolling through your phone, reading alarming health news. Allow your body to settle. Think of it like calibrating a scale. You want data on your body and blood in their baseline, calm state, not in panic mode. 6. Not asking about specific test preparation. Many older women mistakenly assume all blood tests follow the same protocol. Just roll up your sleeve, give blood, and wait for results. However, some tests require very specific timing, special preparation, or medication adjustments, and ignoring these steps can completely invalidate the data obtained. Let's consider a few examples. Fasting is certainly required for fasting blood sugar or lipid profiles. For thyroid hormone levels, fasting isn't mandatory, but the time of day matters. It's optimal to draw blood early in the morning. Iron level tests are also preferably done in the morning and, ideally, not immediately after taking iron supplements. When determining hormone levels, it's essential to know if the patient is on hormone replacement therapy. Cortisol or ACTH levels must be measured at a strictly defined time, usually between 7 and 9 a.m., due to their natural diurnal fluctuations. Parathyroid hormone and calcium should not be checked immediately after taking vitamin D or calcium supplements. A common mistake women make is assuming the pathology lab automatically knows what to do. However, if the prescribing doctor hasn't provided clear instructions on the request form, or if the patient hasn't asked for clarification, she might fast unnecessarily or, conversely, not fast when it was truly required. What should you do before your appointment? Contact your primary care physician's office or the lab directly and ask, "Are there any special instructions for these tests?" This call takes only a minute, but ensures maximum accuracy of the results. Do not leave this aspect to chance. Every patient deserves reliable answers about their health. 7. Alcohol consumption the night before. The purpose of this material is not to condemn anyone's evening habits. A glass of wine with dinner is a perfectly common occurrence, and many patients enjoy this small evening ritual. However, if a blood test is scheduled for the next morning, you should strictly abstain from alcohol the night before. Why? Alcohol, even in small amounts, can raise triglyceride levels, temporarily increase the activity of liver enzymes like ALT and AST, cause dehydration, lower blood sugar, especially in patients taking diabetes medication, and interfere with medication metabolism, ultimately leading to distorted lab readings. Suppose a patient is getting a liver function test. If 2 glasses of wine were consumed the night before, the results might show elevated enzymes, triggering a cascade of repeat tests, ultrasounds, and undue worry. Furthermore, if being screened for metabolic syndrome, that glass of wine could present blood sugar and lipid levels in a worse light than they truly are. It is recommended to avoid alcohol for at least 24 hours before a blood draw, and ideally 48 hours if possible. This is a small sacrifice that guarantees clean, reliable results, reflecting your true health, not the effects of an evening's leisure. 8. Wearing tight sleeves or difficult-to-remove clothing. Perhaps clothing choice doesn't seem like an important factor when preparing for a blood test, but this is a misconception. In clinical practice, we constantly see women arrive in blouses with long, tight cuffs or layered cardigans over turtlenecks, experiencing significant difficulty trying to expose their arm. Some have even had to fully undress in the cramped blood draw chair. Others rolled up their sleeves so tightly that it cut off circulation. Such situations cause delays, increase patient anxiety, and sometimes limit the choice of arm for the blood draw, especially if the person is cold or feels constrained. The phlebotomist needs easy access to the inner elbow area, known as the antecubital fossa, where the most suitable veins are usually located. If access to this spot is difficult, it can lead to a more painful blood draw or require multiple punctures. The advice is simple. Wear a loose, short-sleeve top or a cardigan that unbuttons easily in the front. Ensure your chosen outfit provides quick and unobstructed access to both arms. Comfortable clothing contributes to a smoother process and quicker results. 9. Failure to mention menopause or hormone therapy. This aspect is often overlooked even by medical staff. Hormonal status has a far greater impact on blood test results than most women realize, especially with age. If a patient is postmenopausal or taking hormone replacement therapy, HRT, it is crucial that her physician and the lab are aware of this information. The reason is that estrogen therapy affects cholesterol levels. Women on HRT often show higher HDL, good cholesterol, and lower LDL. However, if this information isn't disclosed, the doctor might mistakenly assume the results are unusually good or that a prescribed medication is effective, when in fact it's a hormonal effect. FSH and LH levels, used to assess menopause or fertility, have completely different meanings depending on whether the patient is taking hormones. Even thyroid function tests can be slightly affected by estrogen levels due to the behavior of thyroid-binding proteins. One patient was once referred to an endocrinologist due to abnormal estrogen levels. only for it to be discovered later that she was still using a transdermal estrogen patch that the lab had not been informed about. Therefore, always mention if you're menopausal, if you're taking HRT, if HRT was recently discontinued, or if you're using patches, creams, or pills with estrogen or progesterone. Even if the information seems minor, it's better to provide the full picture. Blood test results do not exist in a vacuum. Context is crucial. 10. Leaving immediately after blood draw without verification. The injection is complete, the tubes are filled, and the patient is ready to leave. However, it is at this stage that numerous mistakes are often made. Too many women leave without confirming several key details. With a correct test drawn, sometimes the lab forgets a requested tube, or a test is missed due to time constraints. Was enough blood collected? Some tests require a specific volume. If too little is drawn, the sample may be rejected later, requiring a return visit. Was the labeling done correctly? Errors happen. Incorrectly labeled samples have led to serious misunderstandings. It is also crucial to find out how and when the test results will be received. Will the doctor call? Should you check the patient portal yourself? Or do you need to schedule a follow-up appointment to discuss the data? This aspect is especially important for older women. If you have a tendency for dizziness, fainting, or low blood pressure, under no circumstances should you hastily jump up and leave the room immediately after the procedure. It is recommended to sit calmly for a while, drink water, and be sure to inform the medical staff of any feeling of faintness. There was a case where an elderly patient left the clinic too quickly after a blood draw, tripped in the parking lot, and ended up in the emergency room, not because of the test itself, but because she stood up too quickly on an empty stomach. The moral of this story is simple. Don't rush. Ask all your questions and confirm every detail. Your health is certainly worth a few extra minutes spent on attentiveness and caution.